first today. Can you give me your name and date of birth, please?
Mary Smith, 5/18/1963.
Perfect. So, Mary, here I have an order from your doctor to change that dressing on your central line. You have that central line in place because we're giving you that intermittent IV of antibiotics from your procedure of that mastectomy that you had, okay? So we want to make sure it's due to be changed, that we're keeping everything nice and clean to prevent any infections with that, okay?
Okay.
Do you have any questions?
Nope.
Do you have any allergies I should know about?
I think to just a medication.
Okay, is that morphine? That's what I saw in your chart.
Yep.
Okay, good. So only morphine, no allergies to any tapes or skin cleansers or anything like that?
Nope.
Okay, good. So first things first here, our order here is indicating that that needs to be changed. So I need to make sure, in order to not dislodge that line, that you're able to stay nice and still for me. Can you do that?
Yep.
In addition to that, this will be a sterile procedure. So are you able to wear a mask for me?
Yeah.
I'm going to go ahead and give you that mask if you could put it on for me.
Sure.
And I also am going to wear a mask during this procedure. If my patient wasn't able to wear a mask, I would have them turn their head away from the area that we're working the entire time. Also, some lifestyle or lifespan considerations. If my patient were elderly, I would be using skin prep before placing the next bandage or dressing to avoid any skin tags. And if my patient was a pediatric patient, under the age of 2 months, I would avoid using the chlorhexidine skin wash, and then I also may have someone to come help just hold the arm steady for that child. So first things first here, we're going to do some measurements. As I'm getting ready for that, I'm just visually inspecting the arm. I don't see any swelling up the arm or around the insertion site. But Mary, if it's okay with you, I'm just going to go ahead and feel. You let me know if there's any tenderness.
Okay.
Any tenderness at all with
No.
that? Good. Also, I'm going to take a couple measurements. While inspecting my catheter, I'm going to measure in centimeters the amount of external catheter showing from the insertion site. So starting from the insertion site and measuring down to where the catheter starts to widen, I'm measuring at 1/2 inch, so about 1.3 centimeters there. And then from the insertion site itself, I'm going to measure up the arm 6 inches, and then we're going to measure the circumference of the arm. And so we're at about 5.5 centimeters there. That is what was noted in your chart, so there was no deviations. If there was any deviations from that, we would be looking at concerns of things like some like phlebitis that could have dislodged. So we want to take some extra care in looking into why that would be longer than it was before. But everything checks out and matches what your chart had said. So yes, according to our order here, we are going to change that dressing. First things first, we're going to remove that old dressing. And I just want to get some nice clean gloves here. I did note that my PICC line was held in place by a suture and it is intact. So at this point, I could also use a little alcohol to help loosen the bandage. But the entire time I'm pulling towards the catheter insertion site while holding anchor on that as to not dislodge it. So we're going to get it as loose around that site as we can without getting too close. All the while anchoring that, even though my suture is in place, just as an extra safety measure. And then I'm going to pull up and away from the catheter, still anchoring, and removing that bandage. Now here, that suture is holding it in place. My patient can follow commands, so I'm okay knowing that their arm is going to be in this position and they will not move. I'm going to inspect my bandage here for any sort of drainage and document what I found. So at this time, I'm going to prepare my sterile field. I'm going to be careful not to turn my back away from my patient at all or my sterile field. So I have my central line dressing change kit here. I'm going to go ahead and open away from me. Making sure that top doesn't flip back up. I'm not loving, so I'm going to make sure that that stays down to not break our sterile field. Okay, Mary, at this point, do you have any questions?
No.
So I'm going to make sure that you keep that mask on. If you do want to turn away, you can, but if you feel any discomfort during this, you just let me know, okay?
Okay.
So I'm going to pinch my gloves here. And same thing, we want to make sure we can open these in a way that we're not going to break our sterile field. Okay. Only touching the outsides. First glove here, we're going to put on. Not touching the outside. Scoop technique for the other glove, only touching the outside. I'm gonna get our other glove on. And at this point, I can adjust. I just don't want to touch the inside of my glove. So I am now in sterile gloves. I'm going to move that to the side. Things I can get rid of that I'm not going to use are my sterile field there. Next, what I'm going to do is I'm going to grab my tweezers, keeping sterile, as well as my alcohol swab. And here we are just going to gently use this to help hold our lines up, cleaning any blood from that area with a light scrub. And in a circular motion, getting underneath those lumen as well. And we can discard. Next here, I'm going to take my chlorhexidine, squeeze to activate. Again, I'm going to hold my line here. It is activated. Side to side, I'm going to scrub for at least 30 seconds in a 2 to 3 inch circle around the area and under those lines again. And I'm going to allow for that to fully dry. At this point, I can get rid of my tweezers. I have my skin prep. I'm going to, without touching anything, place this in a window around the catheter where that bandage is going to go. We're going to get rid of that, allowing the skin prep to fully dry. Again, that's going to alleviate the chances of giving our patient any skin tears. At this point, everything is clean, so I'm going to place our bandage. I can be a little bit less careful, but I still want to maintain sterility, so I'm going to do the no-touch technique with our bandage. And we want to center that with that catheter in the middle of the window. Doing okay, Mary?
Yep.
So at this point, our dressing is down. We are good to remove the outside border, finishing pressing down those edges of the bandage. Okay. Lastly here, I am going to date and time our bandage. Today is February 1st, 2024. My initial CL, and then the time is 15:20. We're going to place that at the bottom to help hold the lumen in place, not covering anything, so we can still see that full insertion site. Okay, Mary, that dressing is changed there. I'm going to go ahead and clean up all of my materials. And then document. What I'm going to document is the date and time of the dressing change, what I put on the dressing. Also, if it were agency protocol, we would replace our CHG caps on the end, as well as if they required a CHG impregnated bandage to be placed underneath that clear bandage, I would have done that as well. Our agency protocol, we do not need to do that. I did not have that available in my kit. So at this time, I can get rid of all of my garbage. I have date and timed. I'm going to go ahead and document. My patient is in the lowest position. Here's your call light. Can I get you anything else, Mary?
No.
Okay, here's your table. Everything looks safe and sound. We're going to sanitize you. Have a good day. We'll be back.